Let me say that we are here to save the Affordable Care Act, to save lives, to make sure we save people's health insurance. This is a fight for our lives, the lives of our friends and family members and neighbors. It is a fight for health care in this nation. It is a fight that I sat on the Senate Finance Committee and helped lead and help vote for and help pass. And it is a fight that we're going to work to make sure continues to be health care for 20 million Americans and protections for millions more. It's a fight for women's health care, to make sure that they have the right to control their future and their body. It is a fight for the LGBT community, to make sure they cannot be discriminated against. It is a fight to make sure, regardless of the happenstance of where you were born and in what station of life you were born in, that you will have health insurance in this country. And while we talk about the 20 million in America who have health insurance today that didn't have it, right here in our home state of New Jersey, the number of uninsured has dropped by 24%. We have nearly 400,000 New Jerseyans who have health care insurance who didn't have it before. We have real life people. One of them I want to mention by name. She wrote to me recently. I think she's here, Jean. And Jean ultimately is a mother who works to provide for her family 2 jobs. She's self-employed. She couldn't afford health insurance before the Affordable Care Act. For 8 years, she had to go without insurance, without preventative tests or access to a doctor. And despite increasing warning signs, she knew she couldn't afford to get health care until she was, as she said, at death's door. Now, thanks to the Affordable Care Act, Jean was able to get high-quality insurance. She was finally able to see a doctor. She found out that she had high-level hypertension, high blood pressure, Lyme disease, conditions that went undiagnosed for years. She finally got coverage, and as she said, I cannot afford to lose that coverage now. We are seeing Republicans play with Russian roulette in the lives of people in our country, and we just won't let them do it. This is about all of them. It's about 1.5 million seniors in our state alone who depend upon Medicare, and it's about nearly 500,000 men, women, and children that are now getting health care coverage because we expanded Medicaid, and now they enjoy health care coverage as well. So I hear those of you who want to see more. I hear those of you who want us to find a way for lower prescription drugs, and we will find that way. But we will find nothing if we do not have the Affordable Care Act continuing to be the case for 20 million, for nearly 2.5 million in New Jersey, on the exchange, in Medicaid, in Medicare. And that's what this fight is for. It is a fight for lives.